We're going to talk about Chapter 3, Collecting Objective Data, the Physical Examination. I have just this small slide here of a combination of preparation, techniques of assessment for the physical exam, and the different types of examinations that we're going to discuss as we go forward in this chapter. The Chapter 3 objectives include describe the ways to prepare the environment for a physical examination, explain the ways to prepare a client for a physical exam, describe the various positions used to perform a physical examination, describe the correct method used for inspection during a physical examination, explain the correct method used for light palpation during a physical exam, explain the correct use of stethoscope and the purpose of the bell and diaphragm, and describe the various pieces of equipment that might be required for physical examination. Whenever you're thinking about doing an examination, even before you begin, it's almost important to think about your patient and how you can provide a comfort space for them that's private, so that they're not exposed, or you're not discussing anything during the examination that could be heard by others. That you have good lighting to where if you're looking at their skin or looking at other things that you're able to see. Something that is an appropriate exam table that is in a good position for you to where you're not stooping or bending over. And that you have a tray to hold any equipment that you need to utilize when you're doing the exam. So when you are thinking about doing an assessment, you want to anticipate what is the equipment that would be appropriate for that. For example, if you're going to go into a patient's room where there's isolation, well, you're going to think about using your gloves, gown, mask. If you are going to go in and auscultate lungs, well, definitely you would need a stethoscope. If you're doing vital signs, maybe you would need an analog watch that has a second hand, etc. If you know that you're going to be going and looking at skin or assessing pupils or looking in oral mucosa, etc., you want to make sure you have a pen light. The tongue blade, Doppler device, all those kind of things, if you know what procedures you're going to utilize, then you can make sure that you have those with you and that you know how to use those correctly. You're going to prepare yourself. Whenever you knock on that patient's door, you need to examine any thoughts or anxieties that you might have in doing the assessment. Sometimes when you're knocking on that door, you're not sure what's going to be on the other side. So be sure that you are prepared and confident as you move forward with your examination. Your confidence that you project makes the patient feel more confident about your care. You want to make sure that you are providing safety for your patient, such as washing your hands or wearing gloves if you're going to be in with any contact of bodily fluids. We will learn about standard precautions, hand hygiene, your PPE, your personal protective equipment, gloves and gowns, how to take those off and put those on without spreading infection to yourself or your patients. Protecting your mouth, nose, and eyes if needed if you are going to be in a splash zone. Any respiratory hygiene, all those kind of things. Be aware that if you have gloves on and you're dealing with an isolation patient, that you are not how to not spread those germs throughout the room. Your equipment and devices in these rooms, you need to be aware that if there is isolation, that they might have isolation equipment for those rooms. Other than that, you will utilize your own equipment and clean those things between patients. We want to minimize any exposure to bacteria, things like that. There's particular ways you can change the linens, change the beds, etc., that can minimize your exposure. And in foundations, you're going to utilize safe injection practices, how we don't recap needles and you avoid injury to yourself or your patients. We always want to address our clients with respect and dignity. We establish this nurse-client relationship, establish this trust by talking to your patient, by explaining what you're going to be doing to the patient. We never do anything without their permission. We want to make sure that they understand what is expected and required of them as well. If they have any requests or desires, we really try to do those things. If they um, would like to, before we do their assessment, if they'd like to brush their teeth, well, then that would be something that could very easily be done and would make them feel more comfortable and in control. If they are in distress, obviously that takes priority. And so we have to work with them and for their acuity. It's always important to give the patient the rationale behind what is it that you're going to do. The reason why I'm listening to your lungs is to understand if there's something happening or something changing there, so we can document those things and provide that information to the physician. So when they are watching you or participating in the assessment, they may have questions. And that is your role as the nurse to educate them about why things are important. If they ask you why you need to look at their skin, you want to provide some information for them, maybe to help them understand that in assessing the skin and observing and palpating the skin, we can identify if they are at risk for particular wounds or skin integrity problems. So maybe it doesn't necessarily mean that there's a problem right now, but we need to visualize these things um, so we can document. We get that a lot of times when patients ask, why do you need to look at my heels? Why do you need to turn me over so you can look at my back? Well, we're trying to identify if you're at risk for any skin issues, which is very, very important. So, if the client is changing, obviously we're going to give them as much privacy as possible. We're going to drape the patients. We're only going to expose the parts of the patient that needs to be assessed. If when we are doing the exam, we're always going to do the less intrusive procedures first. So when we're doing their vital signs, typically we are doing the temperature, then the pulse, the radial pulse, observing for respirations, and then we'll do the blood pressure last. We are addressing the patient from the right side, and we may have to move to the left side when we're listening to the other sides of the lungs or doing other procedures, but for the most part, we will stay on the right side. Again, you're always going to explain the procedure. You're going to ask if the patient has any questions. If there needs to be position changes, we need to take into account what is going on with that patient and what is it they can tolerate. For example, if your patient's short of breath, but you need to assess their abdomen, you will want to minimize the time that they are supine and flat because obviously that would impact their breathing. So we want to minimize anything unnecessary, be organized when you are working with your patient. So there's different types of positions. There's sitting position in a chair, supine again, which is flat on the back. Dorsal recumbent is sitting up. Your Sims position is on the left side. So these different positions have purposes and different assessments are done in these different positions. So when somebody is in a prone position and they're face down, it's very atypical in the hospital setting that your patient would need to be in a prone position unless they were in a procedure. So there are lists of these positions in your book, and you can look those up and see what those look like. When you're doing your assessments, you are going to use all of your senses. You're going to observe, you're going to smell, you're going to touch or palpate, and you're going to hear, which is a lot of times, which is auscultation. So inspection, palpation, percussion, and auscultation are the different types of assessments. You're going to do these things one at a time, but I would say as you perfect your practice, as you move forward and become more proficient, you might observe and palpate at the same time. You might observe and auscultate at the same time. So you are going to use all of these senses. When you are working with the abdomen, you will inspect, auscultate, percuss, and then palpate, and we'll talk about that going forward. Anything that you find, any abnormal findings that you encounter, you always want to validate these with your instructor. If you're not sure what you're hearing or what you're feeling, be sure you validate that with the instructor or the expert. So again, here's your physical assessment sequence and the sequence for abdomen. So your inspection, this is you seeing, you're observing. You may need lighting, and I would say the more light you have, the better. You're going to observe before you touch anything. You're going to expose only the part being examined. You're going to note for different color, pattern, size, location, consistency, symmetry, definitely in bone structure, things like that, and facial symmetry with smile. You observing those things is very, very important. You're observed for behavior, things that are subjective, odors, sounds, things like that. You're going to palpate. So you're palpating for texture, you're palpating for temperature and moisture, consistency. You're going to use your finger pads quite often for fine discrimination. For vibrations, things like that, you are going to use your palms. Temperature, you will use your dorsals, the back surfaces of your hands. And you're going to ask your patient about tenderness, and we always assess the most tender areas last. With light palpation is one hand only, and you are barely displacing that tissue. You may use a circular motion when you're checking for pulses, tenderness, texture, temperature. Don't have to necessarily do circular, but definitely using those finger pads and into the palm of your hand. When you're using moderate palpation, you're going to displace 1 to 2 centimeters, and that is down, right? So maybe easily palpable organs and masses, which most organs are not going to be easily palpable for you. Besides the bladder, sometimes you might feel the bladder if it's distended. Deep palpation is typically something that we do not do. That's 2 hands, dominant hand on skin. We will not do a lot of deep palpation while you're here this semester. So percussion, we are going to talk about direct, blunt, and indirect. You're tapping body parts and producing sound waves, vibrations. So we might tap to elicit pain when we're talking about assessing for maybe appendicitis, things like that. We might identify if there's any density, say when we're percussing abdomen for sounds, we want to identify tympani. If there's any fluids or solids, we'll talk about the different sounds that are made when providing percussion. So we will do a lot of auscultation this semester. We're going to use our stethoscope. Our stethoscope will have a bell and a diaphragm. So the diaphragm identifies high-pitched sounds like lung sounds, bowel sounds, or heart sounds. The low-pitched sounds are for more murmurs, bruits, more vascular type sounds. We always use scope to skin, and make sure that you know how to use that stethoscope appropriately. A lot of times when you put the stethoscope in your ears, people will tap on the bell or the diaphragm, and you can tell if it's on if you can hear that very clearly when tapping on the diaphragm. You want to eliminate any distracting noise. Make sure your bell, your diaphragm is flush against the skin. And there's different tricks in how to block out distracting noise, and we'll talk about that as we go further. We're going to expose that body part being auscultated, because using scope to skin, you have to be able to have the scope right on that place. Make sure the earpieces are in correctly, and the metal tubes, they're facing towards your nose, because that's how the canals run and the sound. So be sure that you are doing that correctly. It is important to understand, like we talked about it in this slide, the correct use of the stethoscope. You're never going to listen over a gown or clothes. And you are going to make sure that stethoscope sound is on to whatever side you're listening to, the diaphragm or the bell. Some people tap it just to make sure that it's on correctly. And sometimes it's helpful to close your eyes and maybe bow your head down a little bit just to focus. Thank you very much, and that is the end of this chapter. In summary of the Chapter 3, Collecting Objective Data, here are a few comments. After reading the content, do you know how you would prepare the client in the room for a physical assessment? Do you know what are the optimal positions for specific assessments? And what are the correct procedures for inspection, palpation, and auscultation? And which order would you do those procedures in for different things? Also, what is the correct use of the stethoscope and the purpose of the bell and the diaphragm?